The district tells us it is expecting lots of ups and downs this year. Currently, its focus is on the first 30 days, and it says that it wants to get to Labor Day before making any further plans. As we mentioned, many parents across North Alabama are rightfully concerned about sending their children back to the classroom. We are joined now by Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital, to discuss the issue. Thank you for joining us tonight.
Thank you.
Dr. Hassoun, we just heard superintendents across North Alabama are expecting positive cases in their schools. If that's the case, should students be heading back to the classroom?
Yeah, I must say, I would say, no, I disagree with them of saying it's going to be a reality where we're going to see cases, because my main worry with this is as we see cases, it's not going to be just one and will be limited. It's going to be where you'll see multiple exposures and then widespread infection more. So this is definitely much more concerning. I know you can try and put precautions, try to apply prevention method, but I think a lot of people have seen it in other schools in other states where already there's been positive cases even though they just started recently. So I would have major concern. We should not accept even one case happening in the school as a reality. We're going to need to work better than that, meaning we're going to need to cut down on the widespread infection. Then, yes, sure, if there is one here, one there where we can prevent widespread infection, that's a different story.
How do you think schools should handle those cases?
Yeah, so if there is any case that happened in the school, and you know, one main issue I can bring always, I'm not sure what the school planning in the way of testing, because a lot of people, to prevent widespread infection, you need to do testing and you need to do it on a regular basis. But if one case happened and you're going to be able to know how many got exposed to that kid between adults and kids, these ones going to need to be quarantined. But I don't know how they're going to track this and trace it to know how many exposure happened, because the kid's going to play around. They're going to do a lot of other things, whether touching around, you know, contamination around. So it'll be really tough on the teachers and the principals to trace and track all that so you can quarantine those at risk.
We know that younger children are at a lower risk than older adults, but is sending children back to the classroom putting children's lives in danger?
I think it would be, because even though they at lower risk of having a severe infection, we still have seen and been reported all over the United States and the world there are kids who get severely ill with what we call significant immune phenomena, and that can affect their heart, their kidneys, their brain. So yes, they might have less of a severity, but there are cases reported. And you know, again, we cannot accept one death. We cannot accept severe cases with significant after effect, because we're seeing it now. Some of them who recover, they still have problems with their lung or kidneys or their heart. So it is concerning about that.
What about high school sports? School districts in Madison County are starting the school year remotely, but still plan to play sports. Should seasons be delayed?
Yeah, so I think if we really want to play sport, we're going to need to screen these kids on a regular basis, almost every week or every few days, which we know we don't have, because one case happened in the team gonna transmit it to the other, whether in the same team or whoever they play with. We cannot afford doing all this because testing is not readily available for everyone. In addition, even if you test, you're gonna need to wait several days to know the results. So that affects all the logistics of how you deal with this, how you manage this. It is really, I mean, for me, I hope there's not going to be any cases, but at the same time, I hope everybody who's planning to do any of this going to need to understand the seriousness of this, because some people are going to get admitted to the hospital and some will have severe infection and some will die.
Dr. Hassoun, yesterday, Huntsville Hospital CEO David Spiller said the high number of coronavirus inpatients is taking resources from other non-coronavirus patients. How concerning is this?
It is a major concern. I can tell you as staff that I see them every day in the hospital, how much work they go through as a healthcare professional, nurses, all other resources, respiratory therapists, physical therapists, all of them is under stress and pressure. At the same time, the resources that we usually use on ordinary basis for non-COVID patient, there's going to be a lot of strain on it, and possibly with time there's going to be shortage as well. Beds is getting where we need to wait for some of these patients in the emergency room for a long time. So the care and the management of these patients is not going to be definitely where we want it to do the best. We want it as fast as possible. This all, as a logistic, will be affected by having that many patients in the hospital.
We learned about 150 employees in the hospital system are home from work due to the virus, and some nurses are working extra to fill that gap. You're a doctor at the hospital. How stressful is this, and what are you hearing from the nurses?
And you know, again, it's not just the nurses, definitely the nurses in the front line, but respiratory therapists, physical therapists, doctors, all are under a lot of stress and pressure. We want to help every patient. We want to take care of every patient. But as we get, you know, staff absent due to illness, or if their family sick, you know, all of us have families, and nurses have families. They need to take care of them. This has been ongoing for 5-6 months, and there's a lot of, you know, stress on these nurses affected. And I think if we, as a community, not going to help the healthcare, you know, as whole for the Huntsville health system or everybody else in the, you know, in the community, we're looking for reducing cases. There's going to be more shortage. There's going to be effect on how we care for patients. It's going to be a lot of problems in the hospital.
We understand that nobody truly knows the next step in this difficult journey, but everyone is hoping for the best, and that includes a vaccine. So where do we stand on the search for a vaccine?
Yeah, I mean, at the moment, it looks like there is a possibility we're going to have vaccine available by the end of the year. If we really get all these studies wrapped up by October, November, where we'll see if they are beneficial. So there is some hope by the end of the year, but probably to make it widely available for everyone, it's probably going to be, you know, February, March next year.
At this point, we are approaching a month into the statewide mask ordinance. Is it working?
Yeah, you know, I hope there is, you know, always hope the masking would do something, and I think, you know, we probably seen reduction in some, but I still think, and we've said it multiple times, masking by itself is not enough. Physical distancing, all other prevention way of, you know, staying at home if you're sick, quarantine yourself, these are all together help reduce. Masking alone might help some, but we need the whole package to do something and cut down on the cases.
So where do we go from here, Dr. Hassoun?
You know, we say it every week, and we say it to all our patients. We plead to our community to help us out. You know, it's been almost 6 months. We continue to see significant number of patients who's really sick, die, or have significant effect from these infections. The community can help us out in reduction of these cases. Please do not gather in big gathering, avoid the crowd, avoid close spaces, avoid close contact, wear these masks, you know, remember to help each other. If we do that, hopefully we're going to get through this, but we're going to need the help of the community.
Any final message to the community tonight?
You know, we always hope, and we're going to look for a future where we have reduction in cases. We want to buy some time for us at the moment, in the way we have prevention methods that work by the time where we can get treatment and vaccination. So there is always hope, but we need to be realistic. We cannot keep making decisions ourselves. We need to follow public health expert, infectious disease expert of what they're telling us how to do things.
Dr. Lee Hassoun, infectious disease specialist at Huntsville Hospital, thank you so much for your time and insight tonight.
Thank you so much.